So what I'm going to do in this presentation is to share some of a methodology that I developed with colleagues in Kenya and also in other parts of the world over the past, I guess, 12 years or so, really. I'll give a bit of a general description of where it's come from, how it's being used in different places, and then I'll give specific examples of how I've drawn on a couple of these visual methods. I've drafted in Sassy to describe one study, the REACH study, and once she's given a bit of a description, a background of that, I'll give a description of how a combination of participatory visual methods were used as a form of engagement. So yeah, that's it. And then, I mean, I'm not sure whether I'll fill 90 minutes, but we'll just go as long as it takes, really. So, okay, just a bit about me, really. I've been working for the past 25 years or so in Kenya, which is that red country there in East Africa. I'm a kind of mixed methods researcher, so I've used surveys, qualitative methods like IDIs and focus group discussions, and participatory visual methods. I describe myself as having a bit of a pragmatic approach, in the sense that I don't let epistemological and ontological standpoints get in the way of the types of questions I want to answer and the way I answer them. So I'm really happy to use all those methods together, and and they all have their strengths and weaknesses. Surveys have their strengths and weaknesses, and they do a particular thing, and so do all the other methods. I'm also an engagement practitioner. You'll see some pictures of school students there. A lot of my work has involved establishing a school engagement program in Kenya, and that program by now involves engagement activities with researchers and students from across 60 secondary schools in Kenya, probably engaging with over 4,000 or 5,000 students every year. Actually, that's before the pandemic. Things have changed a little bit now, and with all kinds of different activities geared towards not only goals of community engagement with health research, like raising awareness of health research and gaining insights of young people into research, but also promoting science, an interest in science and an interest in science careers. I also work more broadly in public, community and stakeholder engagement with health research. I've been working recently on engagement with COVID-19 trials in Kenya on the engagement side of things, but also I lead a technical advisory group for the WHO on their COVID-19 research. I'm also working on engagement with antimicrobial resistance. I also, part of my job has been to create research engagement tools, videos, animations, trainings for engagement practitioners, evaluation materials, evaluation frameworks, and I've drawn on a lot of these participatory visual methods as a form of co-production of tools for engaging publics and stakeholders with research. I'll talk a bit about that as I move on. So what are participatory visual methods? I mean, it kind of ties in nicely to the last presentation of human-centered approaches. it could be described as a wide range of techniques that involve people taking part in the production of creative outputs that are used to convey their knowledge, experience, opinions, and ideas. I don't know if any of you are aware of a lot of the participatory rural appraisal work that was done by Robert Chambers back in the 80s and the 90s. And he kind of coined it as handing over the stick. In other words, a shift from projects being led top down to more of harnessing what community members have within their group and offering opportunities for communities to lead development projects. In the world of participatory visual methods, that's kind of been slightly changed. Instead of handing over the stick, it's been changed to handing over the camera, which is essentially what it is. It's handing over a camera and enabling participants to create movies about their own realities. It's kind of widely considered to be empowering to participants and to enabling them to be able to steer the discussion and in some cases to steer the agenda. There's a few resources I'm plugging here. If anybody's interested in drawing on some of these methods, together with some colleagues from different parts of the world, we have developed a book. It's a free online book, and it's available on the MESH website. There's also a free training as well. It's an introduction into participatory visual methods. And that's worth having a look at if you're interested in taking some of this work on or drawing from these methodologies. So it's a real massive mix of different things. People use it in different ways and people call it different things, and there are different approaches. Like there's photo, voice and digital storytelling, where participants take photographs and use them to convey their realities and stories. A lot of that's been used in a research context as well as a development context. Participatory art, where participants are encouraged to create art to convey their reality, and that has its uses. I mean, I'm going to describe to you a project that's drawn on participatory art later on. Participatory video, this is an area that I particularly like myself, probably because I'm a bit geeky with making videos and editing videos, and I found it to be a really fun way of working, particularly with young people. And there's also another side of things that's considered a visual method, is performing arts or the use of theatre, but that's kind of mainly used for grassroots health promotion kind of thing, really, as opposed to research. I haven't seen many magnet being used in the context of gathering data. So all these things have elements in common with each other. They all involve initial engagement or sharing of realities, views and ideas. There's some critical reflection on realities. There's a creating media phase. That's kind of cyclic process. And then there's a sharing of media to wider audiences. And then often that will be recycled again. So the uses, as I mentioned earlier, there's a range of uses from community development to communicating realities of vulnerable people, street children, for example, to health promotion. And more recently, I think over the last 10 years or so, participatory video is increasingly being used as a research tool. I'll talk about that in a minute. So where's it come from? I don't know if any of you recognize this fellow on the right here. This is Paulo Freire. He's a Brazilian educationalist, and he wrote a book called The Pedagogy of the Oppressed, and in that book he argues that traditional pedagogy or learning is based on a banking model, I'm sure you've heard of that, where learners are thought of as empty ewers or empty vessels, ready to be filled up with information and knowledge and learning, and then they're good to go, kind of thing. I mean, there's parallels to engagement, to public engagement with this. Back in about 30 years ago, it was felt that if people understood, if the public understood what science was about, then they would be supportive of it. And of course, we all know that things aren't quite as simple as that. So he argued that in order for social change to happen, people need to reflect on their realities, and through doing this, they're in some way empowered or enabled to be able to start thinking about and planning ways of changing their reality. Of course, back in the 60s and 70s, when Paulo Freire, in the 70s, when he was writing about this, participatory video wasn't a method back in those days. But then I think he did write about participatory video specifically as a form of awakening critical consciousness in his later years. So what is participatory video? There's no real kind of definition. I've drawn a definition from this book here, which is really a book about development, but it's quite useful. There's no universal definition to it, and there's no kind of standard method for doing it. It involves people generally without filmmaking expertise in making short films about social issues affecting them, using their own words and their own images. Often it's called authentic voices. And it hands over the control of the filmmaking equipment and of the editorial process to inexpert users. So the facilitator kind of just does simply that, facilitates the process, as opposed to dictate or steer the direction of the project. Okay, there has to be some kind of agreement on what the topic of the project is about, an area of study or area of reflection, but participants, the idea behind it is that participants are given freedom to explore their thinking about it. From my point of view, that this participatory video, as I mentioned, comes from the world of development, projects towards changing people's lives, but I've used it in a research context and as a form of gathering data, and I've used it combined with qualitative methods in order to support the data. A bit about the history, which is quite interesting. The first kind of documented participatory video project was done in the Fogo Islands off the coast of Canada, I think. And it was done by a guy called Snowden, who made a film about the realities of the fishing communities up on the coast of Canada there. And what they did was they made the kind of control of the film was almost entirely by the documentary makers, but they drew on the narratives of the fisherman family, and made a documentary which was then taken to the government and to policymakers, who subsequently changed policies which improved the lives of the fishing communities. So that's the first documented example of participatory video. And, you know, I'm sure you're all aware that over the last kind of 30, 40, 50 years, things have changed in terms of everybody has a camera now. Everybody has a fairly good, decent, certainly in the UK, a lot of people have fairly decent video cameras on their phones. And so the availability of affordable camcorders, laptops, software, and mobile devices have changed, have kind of enabled this more participatory use of filmmaking to develop with time. There's a lot of debates in the literature about what's more important in the participatory video process. Is it the actual process where participants are given an opportunity to develop their own critical awareness of a problem, of their context, and are empowered through this critical thinking to plan ways of attempting to address these things, and the relationships and the mutual learnings? A lot of people argue that that process part of it is actually more important than the video product that you get at the end of it. There's also a lot of people that argue that participatory video should be about a product. There has to be some kind of cause that has to be advocated. The change needs to be advocated for. In other words, it's got to affect some kind of change. But there's a lot of people who argue that product is more important than process, and vice versa. I again, being pragmatic, I quite like both. I think the process is as important as the product. So, I mean, also the degree of participatoriness, if you like, can vary depending on projects, and this can vary a lot on the availability of equipment. For example, we make assumptions about everybody has mobile devices in the UK, but in where I worked in Kenya, a lot of the school children that we worked with there didn't have smartphones at all, and didn't have software, and didn't know anything about how to edit. So that may change the level of participatoriness that your project would be. Social distancing obviously changes things. Also, and probably importantly, the amount that the researcher or the practitioner or the funder is either able or willing to hand over control. And there's a lot of willingness here, because it actually is harder than one might think to hand over control of the project to participants. And so projects vary a lot in terms of how participatory they really are. Here's a slide of the types of equipment that I mean I've used for a project, and this is to produce a fairly good quality video, and for a price tag of about 2,500, you can get a fairly good quality kit that can make you a fairly decent quality video. Alternatively, people have done participatory video projects just with their smartphones. So there's a huge variation, and obviously, you can spend £2,500 just on a camera, or just on a microphone, actually. So, the sky's the limit on how much you spend. This is an example of a methodology that I used in Kenya. I'll just zip through this quickly. What I used a methodology to as a part of an evaluation of an attachment scheme for students who were attached at a research centre at the Kemry Wellcome Trust research programme in Kenya. The attachment students would spend 3 months, and then at the end of it, I would hand over a camera to the students and say, okay, now I want you to make a film that kind of documents your experiences of the scheme. And that process involves activities aimed at enabling students to be familiarized with the equipment. There's lots of discussions about the topic. They plan the media collection, they storyboard, they script, they create the media, they review and edit the footage, We do a group edit usually, unless there's somebody within the group who is able to do it. The problem is with learning a program like Final Cut takes a bit of doing, really. And there's iterative cycles, gathering more media, fine cut, consenting, and then sharing to agreed audiences. Of course, there's also places there where you can supplement the process with data collection if you're doing it in a research context or using it as a research tool. For example, I've used participant observation and note taking, and it's particularly useful to when you have conflict in the group or disagreements about what should be there, what shouldn't be in the final film, and it's a point of interest in particular, because often these points where people disagree are really important. In my experience, and if you're able to document those, then you can capture a lot of information. You can also do focus group discussions as well to formally capture some learnings. So I'm going to show you a couple of examples, and just bear in mind that these are actually made entirely by students. I'll just give you some background. The second one is more of a documentary style the students made. The first one is like almost biographical, but it was made by a group of students who projected what their lives would be like in the future, which was quite imaginative at the time. Anyway, I'll show you this and you can make your own mind up about it.
Meet Teddy Karisachai, one of the best civil engineers in Kenya, who was a member of the school leavers attachment scheme in Cambridge 20 years ago. He relates his success to the time he spent at Cambridge after finishing high school from Nairobi School. This is a picture of Teddy taken when he was on attachment at Cambridge.
My experience at Cambridge was very fantastic. I mean, fabulous. Interacting with successful people at Cambridge was very motivating and eye-opening. The opportunity I had to work at Cambridge and walk around the landscape compelled me to explore the field of civil engineering. Despite Cambridge being a health and research institution, and with most of the staff being medical researchers, they still encouraged me to do my dream career. One of the very best skills instilled in me at Cambridge was time management skills. And this is courtesy of the IT department, where I had to follow a strict time schedule. One of the greatest impacts of this last program on me is that it made me very responsible. And this was possible through the community liaison group staff who would leave behind the office keys with me. At the labs, we had to wait for someone to open for us the doors, and this was quite unpleasant. However, I learned to be patient, and this helped me a lot in my life, especially in campus.
Teddy now runs his own prosperous civil engineering company. He's happily married with 16 children.
I'm in love with this feeling now.
Okay, the second clip, this is more of a documentary style, I guess.
I do believe that some things that people cannot even approach, cannot even touch them or even see them. I had a wrong perspective of scientists before I came to the attachment scheme.
We got a chance to meet scientists who taught us about health science.
What I did was try to take the attachment students through what we do here in the malaria immunology lab, give them lab experiences with what we do with the parasites. We should be part of this community, and so the community should be aware of what is going on within the program.
Like we learned about the burden of diseases in Africa, like malaria, HIV, tuberculosis, and pneumonia. They are forming the burden of our diseases, killing many people or many children in Africa. And I learned the importance of research, that is gearing towards finding preventive measures towards these diseases. So in this, I appreciated, and my views have been expanded.
So in the context of research, I'm going to just put this model down it's kind of useful for you to think about. Okay, it's not particularly precise, and you can pick it to death, but it's a useful way of thinking about it. And I'm sure that Caroline and Sassy over the next few sessions will talk a bit more about this, more about the epistemological kind of origins and positionings of these methodologies. But if you think of a continuum from qualitative methods, quantitative methods across to participatory methods, quantitative methods, more of your kind of post-positive stances, you'd have closed questions and really restricted responses. And that's really very much directed by researchers. For example, in a study about smoking, for example, the question might be, have you smoked tobacco in the last week? And the answer would be yes or no. If you shifted to a more qualitative approach, the questions would be much more open and you'd have a less constrained response. And it's steered by researchers, but less directed by researchers. And maybe the question would be a bit more open-ended, like under what circumstances do you smoke? So you start digging into it. It's not just a binary type of response. It's more digging deeper into the reason why and mechanisms and things. And on the other extreme, you have participatory methods where topics are suggested by researchers, but the content is steered by participants. And the question might be, what's important to discuss with respect to smoking tobacco, or what's the context around smoking tobacco that I haven't thought of as a researcher that kind of imposes a filter on the type of data that I'm collecting. So at that juncture, I'm going to provide an example of how participatory visual methods have been used in more of a research context. So I'm going to hand over to Sassy now, assuming that Sassy's there. I can't see you, but Sassy, you there? Okay, so tell me when you want me to advance.
Okay. So I think, Al, if I understand you right, you want me to give a little bit of a context to the work that you did, the participatory visual work that you did as part of REACH. Yeah. So I'll tell you a bit about REACH. This is a large Wellcome Trust collaborative research grant that that was funded for 5 years, and in fact has just recently finished. And this grant brought together people from 5 different institutions from 4 countries, Kenya, UK, South Africa, and Thailand. And I think you're in the middle of that photo somewhere. Oh no, Ritu, you're not on that photo, unfortunately. You weren't at that trip, but Ritu, who's on this call, is also part of the REACH network. So the REACH programme of work was aimed at trying to understand how we can include vulnerable individuals and populations in research. And I'll come back to the title, Resilience, Empowerment and Advocacy, in a little bit. But on to the next slide, Al. At the heart of the interest of the REACH programme of work was a recognition that there's a bit of a paradox in research, in that when you're working with vulnerable populations, the research itself can be a really important thing to do in order to develop evidence-based interventions that might help to tackle some of the causes of that vulnerability. But at the same time, actually including vulnerable populations and individuals in research, if it's not done really carefully, can actually worsen their situation. So there's this paradox that special protection is needed to conduct research among vulnerable populations, but overprotection, including by blocking research, can mean that important studies don't happen. And so an example of this, a bit of a classic example, is that concerns around vulnerability of children in medicine trials, for example, or drug trials, is that a lot of the medications that are currently used in children are prescribed off license because they've never actually been tested specifically in children because of these concerns of vulnerability and the need to protect. Paradoxically, almost, the dosages that are often given are adapted from data in adults, which I think is a source of concern for many, because you'll often hear that children are not little adults. They actually function differently biologically. So that's the heart of the problem that we were trying to address with this collaborative award. On to the next slide, Al. So the collaborative award had to have some element of focus, and the focus was on women and children. I've just mentioned why children would be a focus. There are obviously many interconnections between children and women, and women are also agents of change in wider families and communities. Just looking at some of those issues down the right-hand side of the slide as well here. Children and pregnant women are often classified as vulnerable populations, given that label in research, and so are often subject to protections for those reasons. There are many challenges in health and in many other fields of life for women and children, and these challenges lead to the need for research that can build interventions to be conducted, and questions around the role that research can play in that the types of studies and the types of advocacy. And there's also questions around how we can support researchers to address the health needs of women and children, not only in study designs, but also over the course of studies being rolled out. To the next slide, Al. So this collaborative award was a social science program of work, essentially, trying to understand how research is actually experienced, research involving populations and individuals that would be considered vulnerable. But we were interested in looking at this from the perspectives of the people on the ground. So in their own voices was something in the title of this research project. So in terms of communities and participants, rather than imposing labels of vulnerability, we were interested in hearing from women, children, young people about their own senses of self, the conditions in which they live and work, and their experiences of research. And we were aware there that we would be seeing not only descriptions of elements of vulnerability, but also agency and resilience, which is why that's importantly in the title of this whole research program. We were also keen on talking to people conducting the research to learn about their experience of working with women, children and families with different types of vulnerabilities, as well as agency and resilience, to see what are the kind of ethics dilemmas that they face over the course of conducting research and how they respond to them. Okay, next slide, Al. So across the program of work, we had 6 case studies looking at the top right-hand side of this slide. These were different types of research study that ethics teams, social scientists, were linked with prospectively. And these were very different types of studies involving very different types of individuals and populations across these different settings, but they were all low resource settings, and they were all conducted in the institutions that I mentioned earlier, in the countries I mentioned, but institutions that were very experienced with conducting research among vulnerable populations. So basically the social science team engaged with the research teams that were conducting the main studies, and had discussions on ethics, reflected on issues that they were facing and how they responded, and also did observation work, as well as interviews and so on. In Kenya, the projects that we were most involved with, the 2 case studies were Chain, which was a project that was looking at building the evidence-based for care of undernourished and acutely ill children, and AHOS, which was looking at the impact of perinatal HIV infection on neurocognitive outcomes in adolescents. So highlighting this because these are populations that clearly would be considered to be highly vulnerable, in need of research, but also where the research needs to be very carefully done in order not to add to vulnerabilities. So in the next couple of slides, I'm just going to give you some of the findings that are most relevant to the visual work that Al will share. So as might be expected, basically what we found was that vulnerability, agency and resilience was very complex, interplaying with each other. So people both exhibited agency and different forms of vulnerability at the same time often. And these resulted from all sorts of interrelated challenges at the structural level, at a situational level, at household, community and systems levels. And so, for example, we found many of the research participants, those involved in the work, had a large number of livelihood challenges: poverty, access to education, decision-making authority, often dealing with very challenging situations in the homes, including in some cases reporting physical and verbal violence. When we were doing studies looking at a particular illness or a health problem, we found that in these contexts, there were many actions and efforts that family members were taking. So, for example, going to various different facilities and so on. And all of these actions, especially given the context, really revealed creativity in individuals and families and agency, but this was very constrained by those contexts. And often these acts of agency would feed back into vulnerabilities, for example, by delays in healthcare, costs adding up, missed opportunities to resolve issues and to get help earlier on. And so we started to see cases of spiraling layered vulnerabilities. And in terms of research activities, additional visits to hospitals or even quite intrusive interviews, time taken for households, anxieties, these could often add to the vulnerabilities and sometimes worked to challenge them. So the research activities of all different forms would fold into these broader complex processes and add to them in different ways, sometimes contributing to what could be seen as a downward spiral and sometimes challenging it and helping to remove and alleviate vulnerabilities. Next slide. So in those contexts, what we saw is that a lot of the researchers who were conducting this research were seeing these different types of vulnerabilities and issues and were themselves being very challenged by them. So in all of these experienced research centres, there were plans in place that if you saw these livelihoods challenges, health challenges, there would be plans, for example, for referral to other clinical or social services, and very detailed, mapped out, examples of what you would do in different situations. And that did sometimes work well in studies where they were embedded within hospitals or clinical units. But sometimes it was actually very difficult to find places to refer on for specific problems. And even where there were referral processes in place, there were often concerns that these referrals were into very overstretched health systems, or they weren't functioning well. And so there was a real concern amongst a lot of the frontline staff and people who were involved on the ground that this was essentially going against a duty of care that they had to research participants, that people were essentially being put on a bridge to nowhere. And that left them in very difficult situations. So on to the next slide. So what we found was that this duty of care, the bridge to nowhere concern, the referral to services where those services onto which they were referred were very stretched, was a significant source of moral distress for research staff of different forms, medical and social science field workers, those who sat in homes, but also those who were sitting in facilities with participants. And there was a concern that in referral processes, you're just actually adding to harms for households that were vulnerable. New costs being added to, would they actually be worth those costs? And basically putting people onto what could sometimes feel like medical odysseys of complex pathways that go to nowhere. So this came out very strongly from early on in our research, and you know, staff in response would sometimes talk about, understandably, digging into their own pockets to try and help people out with basic things like food and being able to pay for referrals themselves and so on. And I think this hopefully just gives you a bit of a context for what it was that we were keen to begin to share through visual methods. I hope that's what you needed, Al.
Yeah. Thanks, Sass. So so I'm just going to talk about a project, a couple of co-production projects related to that. The first one is a film called In Our Voices, which was made in Mae Sot, which is on the Thai-Myanmar border. I think it was probably 2 years ago now, and we did it with those people there on the right, and also on the left is the TAC Province Community Advisory Board for the SMRU research unit. The Community Advisory Board are a group of people representative of the broader communities who live around the research centre, within the catchment of the research centre, if you like. And they some of them have been members of the Community Advisory Board for 10 years. And they regularly meet and they give feedback on studies, on how they're implemented, and that feedback is then taken to the trial team, and the trial team make amendments to the way in which they implement their studies based on the feedback. Oh, sorry, I should have shown a map there. That shows you where Mae Sot is in the on the border there, between, just on the river between Thailand and Myanmar. So the way we did this was we had to do it over 2 days. Often these processes are time constrained because obviously, you know, CAB members are people who work, and we did it over a weekend actually, and they were very happy to come over a weekend, but we couldn't do any more than 2 days. So we had to make everything fit into a 2-day workshop. The purpose of it was to use visual methods, discussion, video, drawing and photography to share ideas about and experiences of vulnerability, resilience and agency in the context of health research participation. We talked about the audience at the beginning of the workshop being basically making a film geared towards health researchers and funders of health research. And I guess the purpose of that was to stimulate some thinking about how research and how funding of research can be modified to address some of these challenges faced in the field. With the CAB members, we had a dynamic consent. which involved taking their consent for filming and taking part in the process right at the beginning. The cab members would take part in the group editing, and that kind of it adds a layer of filter of what's important to include and not include in the film. You know, in other words, what they're happy to include in the film and what they're not happy to include in the film. And at the end, there were several layers of consent from individuals, whether they're happy for the film to be shared, at the institutional level, SMRU, and also amongst the researchers in the REACH group. So in the first day, in order to help discussions and to enable people to talk about their views, we encouraged participants to map different stakeholder groups and the power relations to each other. They were encouraged to use symbols to represent different groups and to sketch different examples of vulnerability and resilience and agency. And perhaps surprisingly to some of you, adults were actually really keen to get on with it, and they really enjoyed it. Actually, they kind of got stuck in pretty much straight away. In between different sketching sessions, there were plenary sessions where people kind of reflected on what was shared. There were opportunities to give some of the REACH findings, and there were subsequent cycles of discussion and sketching, and then a kind of session where the CAB members prioritized what they thought were important elements to include in the final film. So the second day, we had more of a formal decision making about what the film would include, what specifically the key messages would be, and what examples they would use to illustrate those points. We agreed on who was going to do the interviews for the filming, and also we planned specific artworks that would be made by the group in order to convey some of the ideas of the group. So while some of the more detailed artwork was taking place, the filming of the interviews took place. Once we did all the filming, we did a big group editing where we took out bits that people were not comfortable with, and that there was a general consensus on the willingness to share the video to a broad audience. I'll give you an example of some of the things that were taken out of the video. And one of those examples where there was a picture of somebody handing over cash to a policeman, and the message was about I guess bribery and corruption, and people having to pay policemen in order to get healthcare. And it was felt by members of the group that putting that out on a video may put members of the research group and the CAB members at risk. And you know, the thing is, we were able to capture that kind of idea and that piece of data, if you like, without having to include it in the final film. So after the workshop, there was a lot of transcription and translation of the final film. There was a rough edit. Actually, that was quite hardcore for editing for me, given that I don't speak Karen at all. And so editing and putting subtitles was quite a tricky job, but it kind of worked quite well. We layered the artwork on top of the soundtrack. Every group had a chance to review. Subsequent iterations were made based on the reviews by the CAB group and the research group over in Thailand. And the final film or drafts of the film were shared with the CAB members, the production team, the SMRU, for their inputs. and the film was shown with the art in an art exhibition and in different presentations. This is a segment of the film which I'll show you. I think it's a couple of minutes long.
Ano ko kon atagi kolo ba tege wele heo ne atale taki widore peketele keba pato hipo ko pole ki awena ta kota khela ada peketele ta ota oropa
the blood the color awete ba tege ta kota khene hipo ko pho ba blood kone awe poli ba lu awe de keba he weda ne ta kota ke ola go keba lu poli la hi kho mo we lo de awete ne the hair ba the blood na pato ke we la ta ke he le ta khoti ho mo
ta le ta kini abo jini odi mo akhoda ne mi le ra ne me ka ba le kho odi teno ne me sa ke o a mi le ta chu kha so lo shin du ak ba ha le kho lo akhoda ne me ta se to ne mi le tu de me ta sa hi ne ka pe ya mi di mi ba ne ka o ra ne tin nya mo khone ba lu ta se to o mo ja ne
ba kha da awe ke hen la ta khu thi pu ne la awara akacha ago ne mo pagate cha la me awe pa kama aja di la ne la sa pu ne awe ma da awe ta chumo plita mo plita de o de thi
ba ta no ne awe de o do ta vita ma ba pa te kui ta vita ma kho phlo la hi pho kho pho atha sa ne a redomine ta vita ma ho thi don no le ba sa we de ba he khop lo da ma ti we da tho mi ya ba nga we da kli wa de ba kho we da
le mo la pone pol le mo ga he o ple poline pa ki kwathe ga mo kini ne wa ki kwathe ga we ke ba he lu ye follow am no ke ba he we le kini ta bu ke ba he we ma la le ta chu de ta yo de ke ba he we la mo ye ne me le da ko lo da ga le ba ga da le ta phi ama ta lu da mu ne ke ra le ta phi ma chi ma pwe de ne awe me le da chu khane ke ra le pa go de amu go de awe de nyanu wa thuli bo le ma chi ma no ke ra ta ko ra ke le we di go ra kha la da ne phe ne a pwe we go na de ke ra ta ko ra khe che lo academy le ne ke hu klo hu che ne le we di go ne
so that was the work with the community advisory board. This last piece of film, and the next slide is going to be my last slide and the last film. We also wanted to gather the reflections of some of the Reach staff, because we felt that was important, and they had really important experiences to share in doing the research and researching specifically on people's vulnerabilities. But it's kind of hard to do these films during a pandemic. So we made this film through Teams and emails across Thailand, South Africa, and Kenya, where we co-scripted. We did a bit of a DIY recording of the narratives and sharing of the media. I did some editing of the video, editing, sharing, etc., and different, and it's still actually ongoing. It's still a work in progress, and we have a final-ish draft of the video, though it's still not quite the final. And the target audience for this is again researchers and funders of research. So here's a film, but from the perspective of the researchers who are involved in the Reach study. I'll show you a bit of it. I'm not going to show you the whole thing, but I'll show you a bit of it.
We are the frontline research staff. We are the people who gather data, take samples, speak with participants and their families, carry research messages through public engagement events. Some of us are senior in our research institution, some are not so senior. But what makes us similar is that we visit people's homes, and sometimes we even land up sharing meals with them. Often, we are working in our own neighborhoods, in our own communities. We listen to people's stories and struggles with interest, concerns, and sometimes sadness, because these are stories that we know very well. We often land up being the face of research in communities and a bridge between researchers and communities. We have a lot of knowledge to share and face many challenges. Many of the challenges we face are to do with what should we do, What are our responsibilities in the community? These are really often difficult ethical or moral problems for us.
Research is often done in places with a high burden of disease, but also where there are many other health, social, political, or environmental challenges. There may be a drought happening, water shortages, protests around a political election, or staff strikes. In Kenya, communities were facing many of these challenges during our research, including a huge national nurses strike.
Here in Mesot, along the Thai-Myanmar border, migrants who join research on malaria and pregnancy are also sometimes living in fear of being discovered if they do not have documents. The roads and bridges may be blocked or become unavailable because of flooding, making it difficult for people to get to research site, which is also where they come to the clinic for care.
We also see so many difficult journeys. Frontline staff also often have to cross the river in high waters during rainy season.
So the biggest ethical challenges facing the frontline staff are around wanting to help people directly, when research results may not happen quickly and the benefits may not come for many years. Sometimes I wonder why we are gathering data when what I want to do is to help people directly by providing care or medicine, something that is needed today. I realize it is important to develop better health interventions, but then I wish we could do more now. We need more support in responding to ethical challenges in our day-to-day research in our context.
Something that often struck me in my interactions with families in a very low-income area of Nairobi was how much young mothers went through to try to get their babies treated or to keep them well and restore their health. So they would try to access money, which was often not easy. They would seek advice from various networks on what to do, and this included their in-laws, parents, their neighbors, friends, sometimes negotiating with their own spouses. And all of this was happening in what were very often difficult living environments.
Here in South Africa, HIV has been a serious health burden, and so it remains a major research focus. But there are so many other health and social problems that we see people struggling with. Despite the challenges communities face, they show strength and are resilient. It is important not to label people as vulnerable or use stereotypes, because this can mask their unique needs and inadvertently exclude them from research that could benefit them. For example, labeling adolescents as vulnerable to HIV may stigmatize them and hinder participation in HIV research. We also see examples of young people's agency. For instance, they portray themselves as proactive and being agents of change in the community whilst managing the HIV disease. So their inclusion in research is important to inform context-relevant research and interventions which support their agency.
It is incredible to see how families and women will work so hard to provide for their family and make difficult journeys to seek care and to participate in research. People sometimes think that young people or women do not have power to make choices in their lives, but they do. There was a young girl. She was 16 and she joined a study because she said she wanted to gain more knowledge. She wanted to learn more.
So our question is, how can we work together with communities to make sure research priorities align with what matters most to the community? As frontline researchers, we offer a valuable perspective and bridge to understanding people's needs within research and beyond in their day-to-day struggles. But we also struggle in knowing how best to respond to the many dilemmas of care that we encounter in our work, and we need more support.
We hope that by raising our voices, our research leaders, institutions and funders will hear us, and we can work together to ensure that research remains a tool for improving lives for everyone.
So, I mean, I have to confess that in the last film, I didn't do any of the photography. None of it is mine. That was done by staff in South Africa, Thailand, and Kenya. Anyway, so that's all for me.